back to the Target No One Sees podcast. I'm your host, Dr. Michael Choi. I'm a board-certified ER doctor, and today we're going to talk about anti-inflammatories and why it might not be the best idea to take them after an injury. Now, when I talk about anti-inflammatories, I'm talking about one of the most widely used classes of over-the-counter medications in the U.S., also known as NSAIDs, non-steroidal anti-inflammatory drugs. You know them as Motrin, Advil, Aleve, to name a few. For many, they're part of daily life. You take them for injuries, you take them for a hangover. Some people even take them prophylactically before workouts. In this episode, we're going to go over why the rationale for taking them is misunderstood, why inflammation can be good in specific situations, and what other things might or might not help after an injury. And finally, what I do as a doctor when I'm managing my own injuries. Before we get started, though, I'll say a little bit about our goal here at the Target No One Sees. One of the many things the COVID-19 pandemic exposed is how little of our country's public health efforts are focused on keeping you well and preventing disease long before it puts you at risk for things like severe COVID. Even now, 3 years in, so little of the conversation is about how to keep yourself in good overall health, how to reverse those chronic conditions that can still be reversed. And I gotta tell you, this drives me absolutely crazy. I don't want band-aid solutions. I want to address the root of a problem. And I want to pass on information that might actually help you do that. So if any of this appeals to you, please hit the like, subscribe, and notification buttons, as it helps the channel out a lot. Now, what's the rationale behind taking anti-inflammatories after an injury? Well, the conventional wisdom is that it reduces inflammation, and inflammation is bad, right? Well, the conventional wisdom may not be all that wise after all. When it comes to inflammation, it helps to distinguish between acute inflammation and chronic inflammation. Well, what do those words mean in medicine? When a doctor says acute, it's less of a reference to the intensity of a symptom and more about its time frame. Acute things happen abruptly, usually in response to a something, and then it fades rather rapidly or starts to shut off when that something resolves. Think of it like a smoke detector that's gone off because your meatloaf is on fire in the oven, and once you take a broom and do one of these and wave the smoke away, the alarm turns off. The word chronic is probably obvious to you. It's something that lingers. It may come on more slowly and then often persists, like pathologically. Now, chronic inflammation is almost always a bad thing. When you have generalized chronic inflammation in the body, this contributes to many of the most common serious diseases in our country, such as coronary artery disease, which leads to heart attacks, kidney disease, dementia. Chronic inflammation, as it turns out, may even play a role in the development of hypertension, that is, high blood pressure. But what about acute inflammation? Like when you sprain an ankle or break a bone, that part of the body quickly becomes inflamed, swollen, tender, warm. Now, why do I think that stopping this kind of inflammation might be a bad thing? Well, let me give you an analogy. Think of a building where there's been some kind of accident, maybe like a gas explosion. The building is damaged, but can be repaired. It doesn't have to be demolished. However, immediately after the incident, it's still a disaster zone. There's debris everywhere, there's fire and water damage, exposed electrical wiring. Some of the support beams may no longer be load-bearing. Obviously, before you can start repairs and reconstruction, there's an initial phase of cleanup that must be done. You'd have to tear out the burnt and damaged flooring and drywall, clear away the debris, trim away exposed wiring and leaking pipes, and those beams that can no longer support weight, you might have to remove them entirely. To put it another way, you might have to do some cleanup work that is technically more destruction before any construction or reconstruction can begin. Now imagine if you skip this cleanup step entirely. If you tried to just ham-fistedly start building right on top of this disaster zone, well, what kind of results would you expect? Probably not good ones. This is exactly what acute inflammation is. It's the cleanup process immediately after a disaster. And if you prevent it from happening by taking NSAIDs, you interfere with this normal healing process. The research shows us exactly this. People who take NSAIDs after an injury, especially for a prolonged duration of time, they keep taking it, well, they heal more slowly, and the healed tissue may not be as healthy or durable when all is said and done. Sure, you might be more comfortable, you might have less pain if you pop an Advil after an injury, but this is the price that you're paying for that temporary relief. Here's something else you might or might not have known about these drugs, and it has to do with chronic inflammation, the type of inflammation that we generally acknowledge as being bad. Now, the lining of your intestine functions as a barrier between the bacteria, food, waste products, etc., inside your gut, and your bloodstream, which should be relatively sterile, right? Well, these NSAIDs actually make this barrier leaky for about 24 hours after you take the medication, meaning they allow some of this intestinal sludge to cross over into your bloodstream. That ain't good. Any of the food molecules that were being digested and are now in your bloodstream are being attacked by your immune system as foreign. If your next question was, could this be contributing to people having food allergies? You're absolutely correct. There's literature that shows that a quarter of all anaphylaxis cases, meaning the most serious type of food allergy, also had a history of NSAID use. And letting intestinal bacteria cross into your bloodstream is bad for what I hope are obvious reasons. At minimum, this leads to a generalized inflammatory response in order for your immune system to clear away these invaders. And anyone who has a separate inflammatory disease, like rheumatoid arthritis, for example, may actually experience a delayed worsening of their arthritis symptoms after taking these supposedly anti-inflammatory drugs. This brings us to another bit of conventional wisdom with injuries. You all remember the RICE acronym? Rest, Ice, Compression, Elevation? I think only 2 of those are helpful at all, and with significant caveats. Rest is good very early on, but depending on the type of injury, mobilizing that injured area as early as it is safe to do so is a good thing. Elevation might be helpful if done periodically in the first day or 2 to help improve lymphatic return from that injured area, again, very early on. I would scrap ice. This is just preventing the acute inflammation that we discussed before that must happen. And compression is simply limiting the blood flow to and the lymph flow from the injured area, which is just not helpful. Now, injuries are an accepted hazard in my personal life. I'm an active guy, and my one true love as far as sports goes is Muay Thai. So I've had my share of swollen shins, sprained joints, and the occasional busted up face. Beyond that, I lift, run, ski, hike to tall, beautiful scenery, all of which leads to aches, pains, and various types of use injuries. So what do I do for injuries? Well, I try not to take any medication, which I know is not a fun answer, but I do try to look at it through the same lens through which I look at the workouts that may have caused the injury in the first place. No pain, no gain. Viewing the discomfort as a price paid that has some real reward is helpful. I'll take the pain and discomfort now and buy myself a more rapid recovery and a stronger healed body part in the end. As luck would have it, while recording this, I'm actually dealing with a sprained foot. I'll tell you a little bit about it. The first day sucked. The foot was swollen and painful, and I could really only get around with a pronounced limp. By day 2 or 3, I was still limping, but I was able to walk a good bit, so I did that, and I got about 10 to 15,000 steps in a day for a few days. Now, returning to normal training, which for me is kicking things, was not a good idea, but cross-training to some other modality, in this case jogging, was the next step. Now, things like jogging and walking, when safe to do so after a lower body injury, it's beneficial because it stimulates blood flow to and lymph flow from that injured area. Now, I keep using that word lymph. Well, if you're not sure what lymph is, it is the fluid in your soft tissues that surrounds the cells and supporting structures. It's in the interstitial tissues. Now, one function that it has is to drain waste products and carry them away in lymphatic vessels which run parallel to your blood vessels, almost like a sewage system running underneath roads that you drive on. So if blood vessels are bringing nutrients, oxygen, immune cells, etc., to the site of an injury, the lymph fluid is the other half of the equation. It's carrying waste and byproducts of cellular activity and repair away from that site. There's another pillar to my recovery process, and a lot of this talk about blood and lymph flow is at the heart of it. You may have heard me talk about sauna, and sauna is often used for its benefits in workout recovery, but it may also have benefits in injury recovery as well. Now, most of the research seems to be on post-workout recovery, and there's just not a lot of it pertaining to injuries directly. And granted, workouts are causing a kind of microscopic injury to your muscles, but because it's not exactly the same thing in intensity or degree, we can't completely infer the same conclusions. So when I'm telling you this, it's based more on systems-based thinking rather than like randomized control trials. And it's based on what we know about sauna and cryotherapy as well as the human body, so take it for what it's worth. After the acute inflammation has started to subside, that's the first day or 2, I would say, I'll hit the sauna. And I'm already using the sauna pretty frequently, but I'll try to increase the frequency, trying to go every other day or so. And the way I go about it is in the Finnish tradition. Thank you, people of Finland. The sauna I go to in New York has a room that is very hot, often in the neighborhood of 200 to 210 degrees Fahrenheit, close to about 100 degrees Celsius. After about 5 to 10 minutes in there, I'll go right into a cold pool, which is typically around 42 to 46 degrees Fahrenheit, about 5 degrees Celsius. I'll repeat this cycle several times throughout the course of a session, drinking a ton of water throughout. Now, why am I doing this? Let me explain to you what's happening in a hot sauna. The capillaries, these are the microscopic blood vessels in your skin and the soft tissues of your body, they open up and blood flow dramatically increases through those tiny vessels. Now, the walls of these tiny vessels become porous. They allow the plasma, the fluid in your blood, to enter those tissues and that skin, and that fluid helps to supply your sweat glands, which by this point are starting to pour out sweat. It supplies them with that liquid. As the fluid enters these tissues, the lymphatic drainage has to increase in response as well, so that what goes in equals kind of what goes out. Going into the cold pool right after causes those blood capillaries to clamp shut and thus blood flow to decrease. But the cold also causes those lymph vessels to compress, increasing the amount of lymphatic return from those distal areas back to the core of your body. Now, I'm doing this cycling between cold and hot to produce sort of waves of perfusion and then drainage from an injured area. Even if you don't have access to a sauna, I think similar objectives can be achieved using a hot bath and a bucket of ice water. As far as other medications that can be considered when you have an injury, Tylenol, also known as acetaminophen or paracetamol from Europe, is not an NSAID and does not have quite the same effects as the NSAIDs I mentioned before. But I should mention that even blocking only the pain signal itself has been shown to prolong the healing process. I wouldn't call acute pain a good thing by any stretch, but it is functional, and that function is often an important one. So, takeaways. Try to stay away from NSAIDs after an injury. Realize that something important is happening, even if it isn't the most comfortable thing ever. As soon as that initial acute inflammation is starting to subside, and as long as it's safe to do so, consider getting some movement and activity into that injured area. Low-impact activities like jogging and even simple walking, as well as yoga and calisthenics, will improve blood flow to and lymphatic flow from the injured area. Lastly, sauna and cold immersion will accomplish these things as well and may have the potential to speed recovery. That's it. Hope this helps. Enjoy your week, guys. This has been the Target ONC's podcast. Thanks for joining us today. In the coming weeks, we'll have content coming out regarding seed oils, sleep training for infants, and fasting. So stay tuned.